Let's do it.
Hello everybody, my name is Colin Drummond and I'm going to be talking to you about pec minor today. Pec minor originates from the ribs near the costal cartilages, ribs 3 through 5, which would be right around here, going up to your coracoid process. So what the pec minor does is it does protraction and depression of the scapula. It's innervated by the medial pectoral nerve, and the blood supply is pectoral branch of the thoracoacromial artery. So if its action is protraction and depression, in order to stretch it, we need to do elevation and retraction. So a good way to do this is by, you can stand up for me. You put your hands behind your head. I want you to take your elbows and try to bring this back as far as you can. Now can you turn around for me, 360? 360, yep, right now. So as you can see, the scapula is going up immediately on both sides. And now you can put your arms back down and depress and protract. So that is the exact opposite movement of what we have. Back up. Yep. So that is how we'll stretch out pec minor. Any questions, or do you want to see it a different way? Wide, right here. As high as you can. If you want to show, if you want to designate. Yep. Yep, you can go up high, or it's just as high as you can go. It just depends on how much range of motion, flexion, or abduction, stampation, substation has. So
You want to pad your hand because there's those bony, pointy things that are right close to there. But then the important thing is moving that part of the shoulder back. Usually, Brian, could you lie down, please?
Back?
Back. Okay, yeah, that'll do. Okay, so you can lift the scapula up a little bit. Go ahead. Or lift the chest wall up there a little bit. Let's see, put a pillow. Otherwise, you're kind of hanging around. There you go. Good relax. Okay, yeah, that would not be very comfortable. Okay, and so remember that it attaches here on those ribs, so you can put your fingers on the ribs. Then, again, some of the times you could pad, and then a good stretch for the pec minor, good manual stretch, is bringing, remember, the corner of the scapula back. So that's the important thing to remember about the pec minor. And the pec minor is a problem a lot of the time because we spend so much time just angled forward, right? Okay. All right.